Welcome to Chapter 10, Development and Genetics. In this chapter, we'll explore the amazing journey of human development from the moment of conception through birth, focusing on the key stages of fetal growth and the genetic principles that shape every individual, such as yourself and me. We'll begin by reviewing the stages of prenatal development, which are pre-embryonic, embryonic, and fetal. And we'll discuss how organ systems and body structures form. Then we'll shift to the fundamentals of genetics, covering how traits and conditions are inherited and how advances in genetic science are changing healthcare today. So, as future nurses, you'll need to understand the fetal development and genetic condition impacts and how it impacts outcome, patient education, screening, and even family counseling. This knowledge will prepare you to support families during some of the most critical and emotional complex moments of care. In this slide, we'll discuss three primary stages of development, and that's the primary stages of prenatal development. We have the pre-embryonic, embryonic, and fetal, with detailed focus on the pre-embryonic and embryonic stages. Each stage is characterized by developmental milestones crucial for the formation of a healthy fetus. So let's start with the pre-embryonic stage. This is from fertilization through the second week. Fertilization begins with the union of the sperm and the ovum in the ampulla of the fallopian tube. This results in the formation of a zygote, which is a single-cell organism with a full set of 46 chromosomes. So I really want to reinforce that fertilization marks the beginning of human development. Cleavage. So after fertilization, rapid mitotic cell division begins. The zygote divides into smaller cells called blastomeres. Without increasing in size, this process is called cleavage. Marilla. So around day 3, the zygote becomes a marilla. This is a solid ball of 16 cells. The marilla enters the uterus and then continues to divide. Blastocysts and trophoblasts. So let's understand this. The fluid enters the marilla, forming a blastocyst, which is a hollow structure that will become the embryo. The outer layer of the cells is the trophoblast, which will eventually develop into the placenta and other supporting structures. If you refer to your textbook, box 10.1, it's used to describe how the trophoblastic cells begin secreting HCG, which is the pregnancy hormone, and it supports the corpus luteum and maintains the pregnancy. So let's now talk about implantation. So implantation occurs 6 to 10 days after fertilization when the blastocyst embeds into the endometrium. Now you must be aware that implantation most often occurs in the upper posterior wall of the uterus. Once again, I must emphasize that this process is super crucial because proper implantation sets the stage for placental development. So let's now move to the embryonic stage. This stage begins at the end of the 2nd week through the 8th week. And this is a period of organogenesis, which is pretty much the formation of major body systems and structure. So at this time, the embryo is highly vulnerable to teratogens during this stage. So teratogens are like alcohol, certain medications. And major milestones include development of the neural tube, let's see what else, limb buds, and the heart. Okay, so the heart beginning to beat around day 22. Also, you can use your text as reference, table 10.1. It will outline the progression of the development week by week. I do want to point out that external features become more recognizable, like facial features and digits. Lastly, let's move to the fetal stage, and this is the end of the 8th week until birth. And it begins when all major organs are formed but yet still immature. The focus shifts from formation to growth and refinement of formation. So some examples would be like week 12 or by week 12, the genitals, male, female, can be distinguished. By week 20, quickening, that's fetal movement, can be felt. And by week 24, the alveoli forms in the lungs. And by week 38 to 40, the fetus is full term. So I have a question for you. Why is the embryonic stage considered the most critical for teratogenic exposure? That's a good question. So you might want to look that up because it may be on the NCLEX. Okay, so in this slide, they're just showing you in slide A, that's the blastocyst formation. In slide B, that's the implantation into the uterus. So the slide present 2 critical visual stages of early human development. You have A, the blastocyst stage of fertilized egg, and then B, you have the process of implantation into the uterine lining. If you look at picture B, that is the actual uterus. So a lot of times when women receive an IUD, they usually receive it in this area right here. It's the T shape, okay? Right in this area here. See if I can draw it. Let's see if I can draw it for you. So the IUD goes here. It's a T, and the string comes out, down from the uterus, all the way out to the cervix. Just to give you a little information. So in box B, which is the process of implantation into the uterus lining, at this stage, the zygote has undergone multiple mitotic divisions. This is no longer a single cell. It's now referred to as a blastocyst, which typically contains about 20 to 30 cells. The outer layer of the cells is the trophoblast, okay, which becomes a part of the placenta. The inner cell mass will develop into the actual embryo itself. So transformation usually occurs around day 5 post-fertilization as the blastocyst enters the uterus. So of course I have another question for you. Can you explain how the blastocyst is different from the morula? Can you differentiate the difference just to encourage understanding and developmental progression? Okay, so this slide we will discuss the embryonic layers. And as you see here, there are 3 germ layers formed early in the embryonic development. That's your ectoderm, your mesoderm, and your endoderm. These layers are often understood as the foundation for every organ and tissue in the body. So as nurses and nursing students, it's important to understand these layers because it will help you link prenatal developmental to congenital disorders and even organ system functions later in life. So typically around the 3rd week of development, the embryo undergoes something called gastrulation, which is a process that organizes cells into 3 distinctive layers. Each of these layers have a specific developmental responsibility, and disruption at this stage can cause long-term consequences. So let's talk about the ectoderm. This forms the central nervous system, the brain, and the spinal cord. Special senses such as the eyes, the ears, and the nose, skin, hair, and nails, glands, mammary, sweat, and pituitary gland. So what is the nursing relevance here? Neurotube defects like spinal bifida or anencephaly occurs when the ectoderm doesn't close properly. Folic acid plays a critical role in prevention of the spinal bifida neurotube defects. A good patient teaching during preconception and early pregnancy should stress folic acid supplementation to support the ectodermal development. Mesoderm forms the skeletal system such as your bones, your muscle, urinary system, circulatory system, your heart, blood vessels, your reproductive organs. So the nursing relevance here, many congenital abnormalities in the cardiac system originate from the mesoderm or the mesodermal disruptions. Conditions like, congenital heart defects, renal problems, limb malformations often can be traced back to the mesodermal formation issues. These systems are often screened via prenatal ultrasound or postnatal assessments. Endoderm forms the respiratory tract, liver and pancreas, digestive system, the lining of the stomach and intestines. And the nursing relevance here is that the endodermal layer gives rise to the structures involved in digestion and breathing. So 2 critical systems in newborn adaptation after birth. So the 2 most critical systems in the newborn adaptation after birth are what? Good question. That's your digestion and your breathing. So let me give you an example. Meconium aspiration, tracheoesophageal fistula, and perforated anus can all be traced back to abnormal endoderm development. So a clinical application tip. When caring for a neonate with a congenital abnormality, ask yourself, Which embryonic layer is responsible for this structure? How might that explain comorbidities or associated syndromes? Another good question would be, which germ layer gives rise to the kidneys? Do you remember? And if you answered the mesoderm, you're correct. So this may be a little helpful for you, maybe not, but let's try it. This is a tip. Ectoderm equals external things like skin, senses, and nerves. Mesoderm is middle. So mes, it starts with the M. Middle starts with the M. So middle things like muscle, bones, heart, and kidneys. And then endoderm is internal lining, like your liver, your lungs, and your gut. Okay, so we have a question here for you. Let's see how well you do. Is this statement true or false? Central nervous system structures arises from the mesoderm. Go ahead and answer before you move to the next slide. Okay, if you answered, what did you answer? True or false? Okay, so I'll tell you, if you answered false, you're correct, because the central nervous system, includes the brain and the spinal cord, arises from the ectoderm, not the mesoderm. Okay, so this slide highlights the multifunctional role of the placenta, which is a very, very crucial organ, and is critical to fetal survival and maternal adaptation during pregnancy. Understanding its function helps nursing students grasp prenatal assessment complications like preeclampsia and neonatal health risk. The placenta is the interface between the pregnant person and the fetus. It acts as the semi-permeable membrane, allowing selective exchange of nutrients, gases, and waste while keeping the maternal and fetal blood separate. Structures like chorionic villi are embedded into the uterine wall, facilitating transfer. So, what is the clinical relevance here? Well, placental insufficiency, for an example, in hypertension or diabetes, can lead to IUGR, which stands for intrauterine growth restriction, or it can also lead to preterm birth. Hormone production to control maternal physiology. The placenta produces key hormones that support pregnancy. You have the HCG, which stands for human chorionic gonadotropin, and this hormone maintains the corpus luteum early in pregnancy. Next, you have the progesterone, and this hormone maintains endometrial lining, reduces uterine contractions. Next, you have estrogen, and this hormone promotes uterine growth, blood flow, and breast development. You also have another hormone called HPL, which stands for human placental lactogen, and it modifies maternal metabolism to provide glucose to the fetus. So, for nursing students, these hormones can be measured to monitor pregnancy health and screen for complications. Immune protection. So, the placenta protects the fetus from maternal immune rejection. It acts as a barrier to most, but not all, immune cells and antibodies. It also allows passive transfer of IgG antibodies, offering the fetus temporary immunity against certain infections like rubella and varicella. So let's talk about nursing connections. Let's talk about why newborns, or matter of fact, I want you to figure out why are newborns vulnerable to infections and why maternal vaccinations such as a Tdap or the flu are so important during pregnancy. Waste removal is also important. So fetal metabolic waste, that's CO2, urea, bilirubin, passes through the placenta into maternal circulation for excretion. The kidneys. So the fetal kidneys do not fully manage waste until after birth. An implication is the placenta dysfunction may lead to elevated amniotic fluid toxins affecting the fetal well-being. Introducing maternal appetite and nutrient transfer. That's another function of the placenta. So the placenta secrete hormones like HPL, leptin, which would adjust maternal metabolism to increase glucose availability to the fetus. It encouraged the mother's body to increase the calorie intake and nutrient storage, which is a vital adaptation for fetal growth. So, a tip for nursing students. This is why proper maternal nutrition and blood sugar management, especially in gestational diabetes, are essential. The placenta also have hormones that aid in fetal organ maturity. The placenta produces steroids and growth factors that promote lung, liver, and brain development. Like, let's say, corticosteroids. An example, these steroids aid in surfactant production, essentially for the neonate lung function at birth. So let's tie something in. In preterm labor, antenatal, betamethasone is given to mimic this placental function and help the fetus to mature its lungs. So I have to end this slide with some questions. Which placental hormone is most important for detecting early pregnancy? If you answered HCG, you're correct. Why? Okay, another question. Why is passive immunity through the placenta especially important for preterm infants? Because the IgG transfer occurs in the third trimester. Okay, so this is a little phrase that I use to help memorize these different things, okay? So listen to this. The placenta feeds, breathes, protects, communicates, and regulates for the fetus. Okay, so here in this slide, let's dive deeper into the different hormones produced by the placenta, each which plays a distinctive role in supporting pregnancy and fetal development. So these hormones not only maintain pregnancy, but also prepares the mother for birth and lactation. So for nursing students, understanding placenta endocrinology is crucial for interpreting lab results, identifying high-risk conditions such as gestational diabetes, preeclampsia, educating patients on the changes that they may be experiencing at that time. So first, let's look at the HCG, which stands for the human chorionic gonadotropin. Okay, so this is the very first placental hormone to appear, and it's detectable in maternal blood and urine by day 8 to day 10 post-fertilization. It maintains the corpus luteum, which produces progesterone in the early pregnancy until the placenta takes over about week 10 to 12. HCG levels double every 48 to 72 hours early on. This is super important because this is used to confirm pregnancy and assess a viable pregnancy. So, a clinical tip for nurses. Listen to this. So, when I say that it's a clinical tip, this is something you should be writing down and taking to clinical with you, okay? So, clinical tip. Abnormally low or slow rising HCG levels can indicate ectopic pregnancy or impeding miscarriage. So what do I mean by this? That means that if you look at the serum level, this is a blood test, the HCG level, if it's significantly low, abnormally low, or slowly rising, levels can say that this patient is either having an ectopic pregnancy or a miscarriage. Now, high levels of this HCG can indicate a molar pregnancy or multiple gestations. What do I mean by gestations? Multiple fetuses, like either you have a single birth versus multiple, twins, triplets, and so forth. So then you have the HPL, human placental lactogen, and you also have the HCS. And these hormones secreted around week 6. So level rises as pregnancy progresses. So the HPL secreted at week 6 should rise as the pregnancy continues and progress. Now, this hormone also alters maternal metabolism. So write this down. It decreases maternal insulin sensitivity. It promotes the lipolysis and protein synthesis. Also, it ensures a steady glucose supply to the fetus. So why is this relevant to nursing? Well, this hormone is a major contributor to gestational diabetes. We usually abbreviate that as GDM, gestational diabetes mellitus. So nursing students, you should educate patients about glucose screening between 24 and 28 weeks. Write that down. So estrogen, the hormone estrogen is primary estradiol. This hormone increases uterine blood flow. It stimulates uterine and breast tissue growth, and it prepares the myometrium for labor. Also, vascular changes needs to support the growing placenta. So that hormone is going to help promote these vascular changes to grow this placenta. So a clinical tip: decrease in estrogen levels may suggest placental insufficiency or fetal growth restriction. You hear that? A decrease in estrogen level may suggest placental insufficiency or fetal growth restriction. Another hormone, progesterone. Progesterone is primarily responsible for maintaining the endometrial lining and suppress uterine contractions. It's very essential to prevent premature labor, okay? So we need the progesterone so we can prevent premature labor. It helps the mucus plug in the cervix, and it supports immune tolerance of the fetus. So let's connect this as nurses, okay? Let's connect this. A woman with a history of preterm labor may be prescribed progesterone supplements to maintain uterine stability. Relaxin. Relaxin is another hormone that works with the progesterone to relax the uterus, preventing contractions during early and mid-pregnancy. So towards term pregnancy, it relaxes the pelvic ligaments, softens the cervix to prepare the woman for labor. So a clinical insights would be that the patient may complain of pelvic discomfort, joint laxity later in pregnancy. Nurses can explain that relaxin is responsible for this. So, of course, I have a question. Which hormone contributes to the maternal insulin resistance? If you answered HPL, then you are correct. So let's go into a NCLEX style question. A patient in her 9th week of pregnancy presents with low HCG levels. What concern should the nurse prioritize? Ooh, that's an NCLEX question. If you answered possible miscarriage or ectopic pregnancy, then you are correct. Okay, so let me give you something that you can possibly remember. Write this down. H dash E dash P is in Paul dash H dash aura. Okay, so that right there, H E P H R, helps me to remember he eats plenty hormonal relaxants. Okay? He eats plenty hormonal relaxants. So the H stands for HCG, the E stands for estrogen, the P stands for progesterone, the HPL/HCS hormone is the H, and the R stands for relaxin. That's how you can remember these different hormones, okay? He eats plenty hormonal relaxin. HCG, estrogen, progesterone, HPL/HCS, relaxin. I hope that works for you. So let's talk about the umbilical cord. Okay, so this slide provides foundational overview of the umbilical cord, often called the lifeline between the mother and the fetus. So, for nursing students, understanding its structure, function, and clinical significance is super essential for assessing fetal well being and recognizing potential complications at birth. So, let's talk about the formation and the structure. The umbilical cord is formed from the amnion, which is the innermost fetal membrane. It connects the fetus to the placenta, which is embedded in the uterine wall. The structure of the umbilical cord allows oxygenated blood. Listen to this, I'm going to repeat this. The structure being the umbilical cord, allows oxygenated blood, nutrients, and waste products to be exchanged between the mother and the fetus without their body physically mixing. So that's why it's called the lifeline. So let me give you a tip. The cord forms during the first 5 weeks of development and becomes fully functional by week 12. So some of the contents of the umbilical cord includes, well, actually there's 3. The umbilical cord contains 3 contents, 3 blood vessels. Write this down because you'll definitely see it on the NCLEX. So the first vein is called it's the large vein. Okay, so we're talking about the blood vessels of the umbilical cord. So you have a large vein. This carries oxygenated, nutrient-rich blood from the placenta to the fetus. Okay? Then you have, I want to make sure you understand this because you will see this again. So, you have 3 blood vessels. The first one, you have only one large vein, and it carries oxygenated, nutrient-rich blood from the placenta to the fetus. Okay. Then you have 2 small arteries which carry deoxygenated, nutrient-depleted blood from the fetus to the placenta. Okay, super important. That makes 3. 1 large vein, 2 small arteries. So remember, this is a teaching point I want you to stick with. Vein, bring in the good stuff. Arteries, take out the waste. You got that? Vein brings in the good stuff. Arteries, take out the waste. So this is opposite of what students are used to, right? With the circulation. So to clarify, the fetal circulation is very unique. Now you have something called Wharton jelly. This is like a gelatin connective tissue that surrounds and protects the umbilical cord vessels. It also acts as a cushion to prevent compression, also ensuring that continuous blood flow is happening despite fetal movement or uterine contraction. So why is this relevant to nursing? Well, cord compression during labor can lead to variable decelerations in the fetal heart rate, right? So this Wharton jelly helps to protect against this. But in thin cords or cords with little jelly, the risks are higher of this, the cord compression. So are you wondering, what does this cord look like? So the cord dimensions at term are an average length of 22 inches, which are 55 centimeters. That's how long it is. and the average diameter is 1 inch. So that's about 2.5 centimeters. Okay. So what is the clinical application here? Cords that are too short can cause problems during labor, such as restricted fetal descent. Cords that are too long may become knotted up or wrapped around the fetus, nuptial cords, which may or may not affect fetal well-being depending on the tightness. So, assessment in labor and delivery. After birth, the cord should be assessed, and it should be assessed for a few things. Number one, the presence of 3 vessels. If you only see 2 vessels are found, well, the presence of 3 vessels is what you look for. But if only 2 vessels are found, then single umbilical artery is something else you have to look for. And this may be associated with some type of congenital abnormality. So look at the umbilical cord. If you only see 2 vessels and only 2 vessels, or if you see it in one umbilical cord, then maybe there's something congenital going on. Okay. The cord length, you want to look at that as well. You want to look at the thickness. You want to look at the insertion site, like central versus marginal. Also, as nursing students, I want you to document cord appearance after delivery and report any type of abnormalities, especially with a 2-vessel cord, which can prompt further evaluation. So as a nursing student, I want you to make sure that your documentation is on point. Look at that cord, document the length of it, document the width of it, document how many vessels do you see within that cord, okay? So ask yourself, what are the normal contents of the umbilical cord? And if you answered 1 vein, 2 arteries, then you are correct. And this is an easy way for me to remember, okay? AVA, A-V-A, AVA, A-V-A. That means artery, vein, artery, okay? Hey, 1 vein, 2 arteries. Artery, vein, artery. So it's AVA. Okay, so now let's look at the role of the amniotic fluid. Okay, so this slide here explains the vital functions of the amniotic fluid, which surrounds and protects the fetus throughout pregnancy. So understanding its role is super essential for nursing students to assess the fetal well-being and recognize any type of abnormalities like polyhydramnios or oligohydramnios. So functions of the amniotic fluid, let's talk about that. Number 1, it maintains constant fetal body temperature. The amniotic fluid acts as a thermal buffer, right? Insulating the fetus from temperature fluctuations. So if it's too cold, too hot, it kind of buffers that, maintains that. This stable environment supports normal metabolic function and organ development. So what is the nursing point here? What's the key point? Well, when the amniotic fluid is low, then the fetus is at greater risk for hypothermia or overheating. So the second thing is that the amniotic fluid permits symmetric growth and development. So it provides a cushioned environment that allows the fetus room to grow evenly. It also limits external pressure on the fetus structures, helping prevent deformities such as clubfoot or What's another one? Positional abnormalities. Okay. Third, the fluid acts as a cushion. It helps cushion the fetus from trauma. It protects against mechanical injury by absorbing the shocks and impacts from the mother's movement or external forces. So let's say the mother accidentally fall, right? Well, this cushion, the amniotic fluid provides this cushion to help protect the fetus from trauma. Okay, so four, the amniotic fluid also allows umbilical cord to be free from compression. So by surrounding the cords with fluid, it reduces the risk of cord compression, which could cut off the blood flow and oxygen to the fetus. Cord compression can cause variable decelerations on fetal monitoring, such as fetal distress. You might want to write that down. That sounds like a good question for clinical and for the NCLEX. So if the cord is compressed, this can cause a variable deceleration on fetal monitoring, which is a sign of fetal distress. Hint, hint. Okay, so the amniotic fluid also promotes fetal movement and musculoskeletal development. So the fluid allows a fetus to move freely, which is essential for muscle and bone growth. Okay, restricted movement, as seen in low fluid volume, can lead to all sorts of musculoskeletal abnormalities. So, what is the clinical implication here? Low amniotic fluid is associated with kidney problems, also rupture of membranes, or placental insufficiency. Okay? Excess amniotic fluid, the poly, can indicate fetal swallowing disorders, maternal diabetes, or even neural tube defects. So, as nursing students, I need you to monitor the amniotic fluid index. That's abbreviated for AFI. Okay, you have to monitor that, or deepest vertical pockets. And this is usually monitored by ultrasound during prenatal care. So, I have a question for you. How does the amniotic fluid help protect the fetus from cord compression? If you answered, it cushions the cord by preventing it from being squeezed during fetal movement or contractions, you are correct. So I want you to think of amniotic fluid being more than just a liquid environment. I want you to think about it's a dynamic, protective medium essential for healthy development for the fetus. Okay? All right, so now we talk about fetal circulation. So this slide introduces a unique and complex fetal circulation system which allows oxygenated blood from the placenta to circulate efficiently through the fetus, bypassing the lungs, which are non-functional before birth. We already know the lungs are non-functional at this time. Okay, so understanding these pathways is crucial for nursing students to grasp the fetal physiological and anticipated postnatal adaptation. So if you know what you're working with, then you can better anticipate what implementation you need and outcome. So let's overview the blood in fetal circulation. Unlike postnatal circulation, The fetus receives oxygenated blood from the placenta, not the lungs. You got that? Unlike postnatal circulation, the fetus receives oxygenated blood from the placenta, not the lungs. So, where does the fetus get their oxygenated blood from? The placenta. Okay? Blood flows from the placenta through the umbilical vein, enters the fetal circulation, delivers oxygen and nutrients, then returns to the placenta via umbilical cord. Isn't that amazing? So, there are three important shunts in fetal circulation. All right. These shunts redirect blood to bypass fetal lungs, liver, which are, as we know, immature at this time and non-functional before birth. So, one, you have the ductus venosus. This connects the umbilical vein directly to the inferior vena cava. It allows most oxygen-rich blood to bypass the fetal liver and enter the systemic circulation quickly. So why is this relevant to nursing students? Well, because after birth, the ductus venous closes, okay? So it closes as the liver takes over detoxification and metabolism. Second, you have the ductus arteriosus, and this connects the main pulmonary artery to the aorta. It diverts blood away from the lungs, which have a high resistance and are filled with fluid in utero. So why is this significant? Okay, because failure of this ductus arteriosus to close, so failure of this to close after birth results in patient ductal arteriosus. We call it PDA. Okay, patent ductus arteriosus. Okay, this is a very common congenital heart defect. So if it doesn't close after birth, it results in PDA, which is a congenital heart condition. The PDA causes abnormal blood flow between the aorta and the pulmonary artery, requiring medical or surgical intervention. Third, you have the foramen ovale, and it's like a, how can I say it, an anatomic opening between the right and the left atria of the heart. Okay, so this here allows blood flow from the right atrium directly into the left atrium, bypassing the pulmonary circulation. So why is this important? Because normally this normally closes soon after birth when the lungs are expanded and the pulmonary pressure decreases. If this is to be remain open, like the PFO, patent foramen ovale, it can contribute to abnormal oxygenation or embolism risk. So some of the clinical implications for nursing students is really to understand these different shunts and how essential it is for interpreting fetal heart monitoring and newborn assessment. Okay, so if you understand these different shunts, and if you're able to interpret it, then you can use it to help monitor fetal well-being and newborn assessment. So changes in fetal circulation, let's say post birth can lead to respiratory distress or heart murmurs. So, as a nursing student, you must observe for signs of cyanosis, tachypnea, or heart failure in newborns with, let's say, persistent fetal shunts. So, I have a question. Why do these shunts exist in fetal circulation? Why? Well, if you answer to bypass non-functional lungs and immature liver during fetal life, it's correct. What changes trigger closure of these shunts after birth? That's a question. Fetal circulation uses specialized shunts, the ducts, the ductus, the foramen ovale, everything we talked about, to efficiently deliver oxygenated blood from the placenta while passing the lungs and the liver. So postnatal closure of these shunts is essential for normal newborn cardiovascular function. Okay, this is just this slide here provides a visual diagram of fetal circulation showing the pathway of blood flowing through the heart, major vessels, shunts, as we discussed in the previous slide. So I'm going to point out the umbilical vein, and you can look in your book, you should see that too. The umbilical vein carrying the oxygen rich blood from the placenta to the fetus. And then take time to look at your book and find the ductus, okay, the DV, which is the shunt. It shunts blood around the liver. Also here I see like trace blood that flows through the right atrium, showing how most passes through the foramen ovale to the left atrium, once again bypassing the lungs. So I see a lot going on in this picture. You don't have to memorize anything, but this picture here is just really emphasizing the unique fetal circulation, how everything circulates to support oxygenated and nutrient delivery despite non-functional lungs. Okay, so like I said, you don't have to memorize it, but it's good to know, and it's good to study this diagram because it helps you understand the pathway, as it's crucial for understanding fetal and neonates physiology. Okay, so this slide here will talk about genetic advances in genetic knowledge. Okay, so I guess this one here just wants to introduce the key concepts of genetic and genomics relevant to nursing care, and it's highlighting the advances in genetic knowledge and how genetic knowledge is shaping pregnancy management, newborn care, and personalized medicine. So the study, heredity, and its variation. So genetics is the science study of how traits are passed from one parent to the offspring and how these traits vary. So understand heredity helps nurses recognize the pattern of what's inherited, such as the dominant, recessive, sex-linked, which is really crucial when assessing a family history. Okay, so clinical application, nurses, nursing students, collect detailed family and genetic history, right? When you're talking to the patients, you're asking them questions. You are asking them about, do you have anyone who have Down syndrome or any other type of genetic history? And the reason why you're asking these questions is to identify factors of what could be inherited. What could be an inherited condition such as cystic fibrosis, sickle cell anemia, Tay-Sachs disease, which are all genetic inherited. Pharmacogenomics. Okay, so a newer field studying on how individuals' genetic makeup influence their responses to medication. Okay, so they really want to know if medications are given to individuals, how do their genetic makeup influence their responses to the medication? So in pregnancy, this can guide drug selection and dosing, improving the safety for both the mother and the fetus. So, a nursing insight: some medications used in pregnancy may have different effects based on genetic differences in metabolism. Okay, so your metabolism caused by genetic differences can have a different effect on certain medication. So, nursing students, you should be aware of these considerations, especially when managing complex pregnancies that actually require medication. So, part 3 of this, prenatal care for decades, right? So, genetic principles have long been integrated into prenatal screening and diagnostic tests. So some of the examples include maternal serum screening, AFP, ultrasound markers, amniocentesis for your chromosome abnormalities. Okay, so those are particular genetic screenings that they do. So, genetic testing, available tests include carrier screening, and this is for like inherited diseases. It's called carrier screening for inherited diseases. Prenatal testing, such as chromosome abnormalities, they'll test for Down syndrome. There's also newborn screenings, which detects metabolic or genetic disorders early on. So, genetic counseling is essential to help families understand the risk, options, and implications. They also even have something called gene therapy. And this is another emerging field that's focusing on correcting defective genes to treat or to prevent a particular disease. So, although still largely experimental in prenatal care, it holds a promise for the future intervention. I mean, just think, if someone can correct your gene, your defective gene, treat or prevent, it'll have a better outcome. So, they're still working on that. So, question: why is genetic counseling important in prenatal care? Because it helps families understand inherited risk and make an informed decision. Okay, so this slides introduce the HGP, the Human Genome Project, and it's a landmark of international scientific initiatives that has pretty much revolutionize our understanding of genetics and human health, including prenatal care. So, an overview of this would be the project would be the HGP was a 13-year international research effort. I think it began somewhere in 1990s and completed in 2003. So the goal was to map map, sequence, and identify the function of all human genes. So, this monumental achievement created a detailed blueprint of human DNA. Definition would be, let me see, what would be the definition that's a little more understandable? It is the complete set of genetic information in a person. So it's the genetic information in you, okay, including all genes and non coding DNA. It also serves as genetic blueprint that directs growth, development, and cellular function. So, what's the difference between the genotype versus the phenotype? Okay, you hear genotype, phenotype. Well, genotype is the specific gene inherited from both parents. This includes all genetic information passed on, whether expressed or not. The pheno with the P, the phenotype, is the observable traits or characteristics resulting from interaction of the genotype and the environment. I'll give you an example. Eye color, blood type, or presence of a genetic disorder. Okay, that's the difference. So I want to emphasize that two individuals can have the same genotype but different phenotype due to the environmental influences or gene regulation. So why is this important? Why is the HGP important? Because it paved the way for personalized medicine, including targeted therapy, improved genetic screening in pregnancy. This slides introduce fundamental concepts about genes, chromosomes, and inheritance, forming the basis for understanding genetic traits and disorders, which are the key knowledge for nursing, caring for families. So let's talk about genes. Genes are the individual units of heredity responsible for all traits, both physical and mental. Each gene is a segment of DNA that occupies specific location called locus on a chromosome. Genes determine a particular characteristics in an organism by coding the protein that influence development and function. The DNA and chromosomes, like the DNA, is a long double helix molecule that contains genetic instructions. The chromosomes are long, continuous strands of DNA wrapped around proteins carrying genetic information. So humans typically have 46 chromosomes arranged in 23 pairs. Determination of characteristics. It's the combination of the genes inherited from parents and contribute to physical traits like your eye color, your height, mental characteristics. So some traits are influenced by multiple genes or by environment as well. So karyotype is a pictorial analysis of the number, size, and shape of chromosomes within that cell. It's usually clinically, it's used clinically to detect, let's say, chromosome abnormalities such as Down syndrome, which is trimosome 20, which 21, I'm sorry, is it's Down syndrome is 21. It's the presence of an extra chromosome, okay? Turner syndrome, that means that you are missing the X chromosome in females. So it's key in diagnostic tool it's key. Your inheritance is key in the diagnostic tool in prenatal genetic testing. So, why is this relevant to nursing students? Because nursing students should be able to understand basic genetic terminology to interpret genetic results, educate the families, and even provide emotional support. Collecting a 3 generation family history. Okay, so 3 generation, that means you, your mother, your grandparents, will help identify inheritance pattern and risk. Question: is this statement true or false? A person's phenotype can include the color of their hair. Okay, I'll give you time to answer it, but if you answer true, then that is correct. Because phenotype refers to the what you can see, physical or behavioral traits of an individual. The hair color is classic example of a phenotype trait, meaning that it's an outward characteristic that's influenced by one's genes or genotype and sometimes the environment. This slide shows a visual diagram of the structure of the genetic material from the DNA. I'm looking at it. So it shows the structure of a genetic material from the cell, because the cell is here at the top, to DNA molecules, helping. So I want you to just really just take a look at this, because it's almost like it's helping you to visualize how genetic information is being organized. Okay, so it start at the cell, the basic unit of life, as we all know, and then inside the cell is the nucleus, which is the house. It houses the chromosomes. The chromosomes are long strands of DNA tightly coiled and packed. The DNA is made up of chemical bases. Let's see. So just take a look at the picture and just familiarize yourself with it, okay? The organization, if you understand the organization, you'll be better to grasp how genetic information is being stored and transmitted. So this slide here explains what a karyotype is and how it's used to analyze chromosomes for genetic assessment, which is an important tool in prenatal and neonatal care. So karyotype is we talked about this earlier, it pretty much represents an individual chromosome. It analyzes the number, the form, the size of the chromosome to detect abnormalities. Also, analysis help identify genetic disorders by missing or extra chromosomes or even structural changes. Okay, so some of the sources for karyotyping that's commonly performed would be like using white blood cells. So from the patient's blood sample, they'll get some white blood cells and they can do the karyotyping. So in prenatal diagnosis, fetal cells are obtained from the amniotic fluid or the CVS sampling. So these cells are captured, they're photographed, they're arranged for analysis just so you can see the big picture. So chromosome numbering and sex chromosomes are something else that's commonly looked at. And these are chromosomes that are numbered 1 through 22. And it's in order from like the largest to the smallest. and they're also called the autosomes. So 23, or the 23rd pair, are the sex chromosome designated as X and Y. Females typically have two X, men typically have an X and a Y. Why is this clinically important? Because it detects chromosome abnormalities such as the Down syndrome, the Turner, which the Down syndrome has an extra chromosome. The Turner syndrome is missing an X chromosome. Then you have other syndromes too that have an extra X chromosome. In males, it looks like XXY. So it's important because this karyotype provides critical information for genetic counseling and pregnancy. Okay? So this slide introduces different genetic inheritance patterns, which can help explain how traits and disorders are passed from parents to offspring, which is a foundational concept in genetics for nursing care. So these also involve mutations in a single gene, also follow clear inheritance pattern first described by Gregor Mendel. Pattern of inheritance is also important because many inherited diseases follow these patterns. Okay, you have something called autosomal dominant inheritance, and really that means only one copy of the mutated gene from either parent, mom or dad, is needed to express the trait or disorder. So the pattern of inheritance affected individuals have a 50% chance of passing the trait to offspring. Example, Huntington disease, Marfan syndrome. Okay. So autosomal recessive inheritance requires two copies of the mutated gene, one from each parent, for the disorder to be expressed. Parents may be carriers without symptoms, so make sure you provide examples like cystic fibrosis or sickle cell anemia. The testing pattern of inheritance will be fundamental for those testing. So X-linked inheritance refers to genes located on the X chromosome. More commonly, it affects men or males, since males only have one X chromosome. Also, X-linked recessive inheritance, male with the mutation on their single X chromosome express the disorder. Females usually carriers, but not typically asymptomatic. Some of the examples would be like hemophilia or muscular dystrophy. So another one is X-linked dominant inheritance, which affect females and males and can express the disorder. Less common than recessive X-linked conditions. Multifactorial disorders result from a combination of multiple genes and environmental factors. So, for an example, cleft lip, palate, neural tube defects, and some type of diabetes are not uncommon. Non-traditional inheritance include pattern like mitochondrial inheritance that's really only passed from the mother. These classic patterns are more important in some genetic diseases. So pretty much for nursing students, You want to know these patterns because they'll help you in the risk of assessment, genetic counseling, and education. So in this slide, it's pretty much visually representing the autosomal dominant inheritance, which should help students understand how the pattern affects the offspring when one parent is affected. So let's go back here. Okay, so this slide here visually explains X-linked recessive inheritance, focusing on how traits or disorders on the X chromosome are passed, particularly highlighting the differences between male and female. Okay, so the X-linked recessive disorder are caused by mutations on the X chromosome. The father is normally XY. His single X chromosome does not carry mutation. The mother is a carrier XX. One of her X chromosomes carry the mutation. The other one is normal. Males, which is XY, inherit their X chromosome from the mother and the Y from the father. So listen to this. Sons have a 50% chance of being affected if they inherit the mutated X. Sons cannot be carriers if they inherit the mutated X. They will express the disorder. Females XX, normal. Both X chromosomes are normal. Carrier, only one normal and one mutated, usually asymptomatic because the X is normal. This slide illustrates X-linked dominant inheritance, showing how mutation on one X chromosome can cause disorder in males and females. So, question. Is the following statement true or false? Males are commonly affected by X-linked recessive disorders. Okay. If you answer true, then you are correct. Males are more commonly affected by X-linked recessive disorders. Okay, so this slide's introduced the main types of chromosome abnormalities, which are crucial for understanding many genetic disorders encountered in maternity and pediatric nursing. So the first one you have is abnormalities of the chromosomes. That just really means maybe missing one chromosome from a pair. So like one copy instead of two. Or you can have an example of Turner syndrome, which you have 45 in the X. So you have different types of chromosomes. You have like the presence of an extra chromosome, 3 copies. You have Down syndrome, 21. You have also 18, which is Edwards syndrome. You have 13, which is Patu syndrome. So you have different types of syndrome and abnormalities. This slide here is just providing a visual reminder of real life impact chromosome abnormalities can have on a newborn and infant. Okay. So here you can see the baby's physical features, the growth development, which is usually contributed to chromosome abnormalities. These changes may be visible at birth or become more apparent as a child grows. So, understanding these abnormalities will help you as a nursing student to provide compassionate, informed care to the effective to the affected infants and their families. This slide here outlines specific chromosome disorder that nursing students should recognize along with their genetic biases and clinical significance. So, structure abnormality results from a change in the structure of chromosomes rather than the number. Example would be Cry-du-Chat syndrome, which is caused by a deletion on the short arm of chromosome 5. How did they come up with this name? It's very distinctive. It's cat-like cry in effect of infants. Okay, so you'll hear an infant crying and it sounds like a cat-like cry. So features include intellectual disability, delayed development, and a distinctive facial feature. So moving to Fragile X syndrome, which is caused by a mutation on the X chromosome, leading to fragile sites. Most common inherited cause of intellectual disability, especially in males. So once again, this is the most common inherited cause of intellectual disability, especially in males. Some of the symptoms may be disability, learning disabilities, behavior challenges, and distinctive facial features. Also, we have sex chromosome abnormalities, which involve abnormalities in the number or structure of the sex chromosome, X and Y. So you have Turner syndrome, which is the abnormality 45X, females with a single X chromosome. Their characteristics are short in stature, infertility, heart defects, and certain learning difficulties. You also have the Case syndrome 47XXY. This here is more I'll say males with one or more extra chromosome. Features include tall stature, hypogonadism, infertility, and sometimes learning difficulties with this syndrome as well. So why is this relevant to nurses? Because nurses should be aware of the syndrome for early, so you can recognize this early and refer to genetic counseling and just really be supportive to your patient. So understanding these help educate families about the prognosis and management. So the purpose of this slide is pretty much to just address ethical, legal, and social concerns surrounding the use of genetic formation, which is a critical topic for nurses and nursing students working with genetic and this very specialized data. So key point, risk of profiling. Genetic information may be used to predict a person's risk for certain diseases before the symptoms appear. So while this is very useful, it can also lead to labeling or profiling. So privacy and confidentiality, breaches. Okay, genetic data is highly personal. So unauthorized sharing or breaches can harm individuals and their family. Workplace discrimination and access to health insurance. So individuals may face discrimination based on genetic risk factors, concerns include maybe they'll get denied for employment, maybe insurance coverage. Also, loss of autonomy. Individual may feel pressure into genetic testing or interventions. So, respect for informed consent and decision making is essential. So, possible injustices with risk determination years before the disorder occurs. So, predictive testing might be labeled or might label someone at risk long before any symptoms happening. So, you predict their testing, you have labeled them, but yet they don't have the symptoms as of yet. So, this raises ethical questions about psychological impact on life choices. So, for an example, you predict that Jane Doe will have this condition. Jane Doe feels fine. She doesn't have any problems right now. But you've already predicted and you told her, hey, Jane Doe, you have this particular condition. Now, how is that going to impact her psyche? And what type of life choices will Jane Doe make? Because now they're aware of this condition, but yet asymptomatic. Okay, so why are we talking about the potential misuse of genetic information? Why is it relevant to nursing and nursing students? Because nursing must advocate for confidentiality, ethical use, and patient autonomy. You got to be aware of the legal protections like Genetic Information Non-Discrimination Act, which is called GINA, in the U.S., okay, or wherever you live. You have to support patients and their family in understanding the implications of genetic testing. So, genetic evaluation and counseling. So, this slide introduced the concept of this genetic counseling, emphasizing its importance in maternal and pediatric nursing for risk assessment, education, and informed decision making. So, a key point here, some of the key points are definition of genetic counseling. Okay, this is a process where individuals or family at risk for inherited disorders are provided with information about the disorder's nature and consequences, their likelihood of developing or passing on the condition, and options for management, prevention, or planning. So, the goal of genetic evaluation and counseling is to help patients make an informed decision that may prevent, avoid, or lessen the impact of the genetic disorder. So, the reason for referrals, there may be many reasons to refer someone for genetic counseling, such as a family history of genetic disorder, previous child with a genetic condition, pregnancy with abnormal screening, known carrier status for certain conditions. So you can refer to your textbook, box 10 and point 2, for a detailed list. So timing is very important. The ideal time for genetic counseling is before conception, before you get pregnant, allowing the best possible planning and intervention. So, why is this clinical relevant? Nursing and nursing students often play a key role in identifying candidates for genetic counseling and facilitating referrals. Counseling can help families understand the complex information and even cope with emotional aspects. It also supports informed consents, anonymous decision making. So, a teaching tip for nurses. This, nurses really can communicate information effectively and compassionately. I want you to really make sure you are effective and compassionate when you deliver information to the family. So let's outline the key nursing responsibilities in genetic and preconception counseling, emphasizing the nurse's vital role in patient education and care coordination. So, beginning preconception counseling. So, as a nursing student or nurses, you often initiate conversations about genetic risks before pregnancy to support family and keep them informed of planning. Also, early discussions help identify potential concerns and referrals. Another responsibility would be taking a family history. Nurses do that all the time. A thorough family history is essential to really identify inherited conditions or risk factors. Nurses should ask about genetic disorders, birth defects, miscarriages, ethnic backgrounds. So I want you to make a note of this. When you go to your clinic and you're in the OB area and you are taking a family history, I want you to really ask the patients about risk factors, about genetic disorders, about birth defects, miscarriages, their background, the ethnic background. Okay? You might want to ask, about when we say ethnic background, well, we know sickle cell anemia is more common in African Americans, right? So that's something you may want a referral for. So then, after you obtain your information and you have something pertinent, you'll schedule genetic testing. You'll coordinate and facilitate appropriate genetic testing or screening or diagnostic tests based on your risk assessment. Understand indications and timelines for the different tests is very important. So now, also a responsibility of the nurse is explaining screening and diagnostic tests. As a nurse, you have to be clear. You have to communicate the purpose, the benefits, the risk of the test as a carrier screening, amniocentesis, or a CVS. You need to ensure that the patient understands the limitations and possible outcomes. And then it is your role to question and address the patient's concern. Please provide empathetic support and accurate information to help patient navigate complex and emotional topics. So why is this clinically irrelevant, or why is this relevant to nurses? Because nurses are often the very first point of contact. And as a nurse, you play a critical role in patient education. Nurses come to you first. Effective communication improves patient understanding and participation in care decisions. So I want to encourage you to make sure you take a good history, explain genetic testing. I want you to use clear speech, jargon-free language. So let's highlight important ethical, emotional, and advocacy roles that you will play, nurses will play, nursing students will play when working with patients undergoing genetic evaluation and testing. So another responsibility, a key nursing responsibility and role, you're going to have to discuss, well, maybe discussing costs, benefits, and risk of health insurance uses. Sometimes the nurses do this, sometimes they don't. Sometimes we have to inform patients about potential financial implication of genetic testing. Sometimes we have to address the concerns about possible insurance discrimination or coverage issue. Also, we have a role to recognize ethical, legal, and social issues, meaning that nurse must be aware of issues such as informed consent, confidentiality, the potential for genetic discrimination, also to stay informed about relevant laws and patient rights. It is your responsibility to safeguard privacy and confidentiality. Genetic information is sensitive. We must protect and be careful. Ensure all communication records are handled with discretion. It is your responsibility to monitor emotional reaction. So, receiving genetic information can be stressful and overwhelming. Okay? Watch for signs of anxiety, fear, or distress. It's your responsibility to provide emotional support, offer compassionate care, listen actively, validate the patient's feelings. Be a source of reassurance during uncertain times. It is your responsibility to refer to appropriate support group. So if you see someone that has anxiety, depression because of this information, don't just document patient appear to have anxiety. I want you to ask these patients how they feel. Tell me your concerns, and then do something about it. Connect the patients and families with counseling services, support groups, resources that's tailored to their particular needs. Support networks can help them with like coping or just adjusting to the information that they received. Why is this relevant for nurses? Because you, as a nursing student and a soon to be nurse, are advocates for patients. You're advocates for patients, their rights, their well being in the complex of all fields, including the field of genetics. Emotional and ethical sensitivity enhances patient trust and quality of care. Okay, this is the last slide, and this concludes chapter 10. I hope it was beneficial. I hope you learned the different genetic abnormalities and just really how to provide the best nursing care that you can. Have a great day.